When it comes to pregnancy and nutrition, how many times have you heard someone say that you or your client are eating for two now? While it's true women need more energy or calorie intake during pregnancy, the idea of eating for two isn't exactly accurate and can cause a lot of confusion about how much to eat. Today, you're going to learn why eating for two is a myth and what the real deal is about energy intake during pregnancy. We're also going to tackle pregnancy weight gain, which can be a sensitive topic for some women. While guidelines for gestational weight gain exist, it's also important to remember that each woman's body is different. Factors like body size, diet, and digestion changes over the course of pregnancy all affect weight gain. The goal is to eat enough calories to support both you and your baby without increasing the risk of complications from an intake that's too high. Now, I know discussing weight can be tough with many conflicting messages and emotions. Some women may feel excited about their body changes while others find it challenging. If you're pregnant, whatever you're experiencing is probably normal. It's important to approach this topic with kindness and empathy, backed by clear, evidence-based information. If you're pregnant, I hope this helps you feel confident in your body's ability to nourish a baby. If you're a coach, I hope this helps you support your client who's pregnant in staying healthy and strong. Remember, our focus is on practical and manageable recommendations to avoid adding unnecessary stress. So in this video, we'll cover 2 key strategies that support a healthy energy intake and weight gain throughout pregnancy, 5 key tactics that you or your client can use to implement these strategies. Together, these strategies and tactics will help you eat appropriate amounts of food to support your baby's development with less stress. So let's get started. First off, it's completely normal and necessary to gain weight during pregnancy. Weight gain during pregnancy includes increases in blood, uterus and breast tissue, fat tissue, extracellular fluid, amniotic fluid, placenta, and the weight of the fetus. In general, the recommended weight gain during pregnancy is about 25 to 35 pounds or 11 to 16 kilograms. Some women may feel worried if their individual journey doesn't align with what's perceived as normal, but as I've said, each woman's experience with gestational weight gain is unique. Work with your healthcare provider to identify what's right for your body and your pregnancy as that pregnancy progresses, or suggest your client does the same. While women need to gain some weight during pregnancy, too much weight and body fat can pose risks. A caloric intake that's too high can lead to a larger baby, which may result in a difficult birth and potential health issues for the child later in life. Higher body fat percentage during pregnancy can also increase the risk of gestational diabetes, hypertension, and other complications. So the goal here is to try to hit the sweet spot. If you're a coach, keep in mind that your client's healthcare provider will monitor her weight gain, but you can support her in adopting healthy nutrition and exercise habits. Rather than focusing on eating right, I like to think in terms of strategies that will help you navigate the process of increasing your energy intake in a way that feels doable and manageable for you. So let's dive in. The first broad strategy we'll look at is eating the right amount of energy or calories for each stage of pregnancy. It takes a total of about 80,000 kilocalories to support a full-term pregnancy, but these energy needs aren't the same across all phases of pregnancy. Think about what's actually happening in the body. It doesn't require the same amount of energy to grow a fig-sized fetus as it does to grow a babe that's gaining a half a pound per week, right? According to the American College of Obstetrics and Gynecology, known as ACOG, here's what's needed for each trimester of pregnancy. During the first trimester, no extra calories are needed, which is a good thing because as we'll explore in day 3, many women don't want to eat much during that time anyway. So you may not gain much weight in the first trimester. During the second trimester, energy needs go up to about 340 extra kcals per day. That's about 1 extra small meal or medium snack like a small sandwich. You may start to notice more weight gain in this trimester. During the third trimester, energy needs go up about 452 extra kcals per day. That's 1 medium-sized meal per day, like a chicken breast with a potato and some veggies. You can expect to continue gaining weight, usually between half a pound and a pound per week. However, eating more starts to get trickier as a lot of women have indigestion and heartburn as the growing baby puts pressure on the stomach. So how can you or your client work toward finding that sweet spot for energy intake? Our next strategy can help. Strategy number 2 is to learn and honor the body's physiological cues for hunger and fullness. This strategy is helpful throughout life, not just while pregnant, though even if you've gotten good at this already, you might find that you need to recalibrate during pregnancy because your hunger cues now feel different. As we've said, every person is different and learning and responding to your hunger cues takes practice. So here are some tactics that will help you or your client put these strategies into action. Tactic number 1, check for hunger. Your first tactic is to get in the habit of doing a hunger check. Check in with yourself before a meal or encourage your client to do the same. You might ask yourself questions like, am I physically hungry? Does my body need food right now? How can I tell? With practice, you or your clients can get better at identifying physiological hunger signs. Additional questions to consider. Is my stomach growling? Is my energy dipping? Am I feeling fuzzy-headed? Has it been more than a couple of hours since I last ate? Hunger signals may change with your pregnancy. You might feel a sense of fullness, but not because you've eaten, but rather a feeling of low energy or being spaced out might be a better cue. Which brings us to tactic number 2. Use a hunger and fullness scale. You or your client can rate your hunger and fullness on a scale of 1 to 10. 1 is extreme hunger, like not having food for several days. 4 to 5 is being moderately to mildly hungry, and 10 is where you've eaten too much and you feel physically sick or bloated. After eating, you'll want to aim for around a 7 or 8, feeling satisfied and no longer hungry, but not stuffed. Before, during, and after each meal, you or your client can ask, on a scale of 1 to 10, where am I right now? Jotting down notes after the meal can help tune in and better identify hunger and fullness cues. And this brings us to tactic number 3, eating slowly and mindfully. Slow and mindful eating can improve our ability to recognize when we've had enough. This can help calibrate hunger and fullness in the right zones, while also helping you feel calmer around mealtimes and have better digestion. So with this practice, you might try slowing down, noticing tastes and textures of food, and sensing hunger and fullness as you eat. One simple way to slow down is by setting your food or your fork down every time there's food in your mouth, giving yourself time to chew thoroughly before taking another bite. Another practice is to pause every few bites and ask yourself, how does my stomach feel? Have I had enough food to satisfy my body's needs? How can I tell? Now, I fully recognize that if you already have small children or a super demanding job where you only have short breaks to eat, this practice might not always be possible, and if not, that's okay. Remember, none of these is a hard and fast rule. Experiment with this practice when and if you can. Tactic number 4, eat smaller, more frequent meals. A lot of moms in the GGS community recommend this as a strategy that helps decrease nausea in the earlier stages of pregnancy, while also cutting down on indigestion that can come from having larger meals during later stages of pregnancy. By the 3rd trimester, eating large meals may become difficult because the baby takes up more space, leaving less room for your stomach to expand. So instead of 3 to 4 large meals, aim for 5 to 6 or more small meals or snacks throughout the day. This can also help maintain energy levels and prevent discomfort. And now, your final tactic for today, having known portion sizes for various foods or meals. You never need to count calories during pregnancy, but it can be helpful to have a general sense of what portions make sense. Instead, you or your client can use a measuring tool most of us have with us at all times, our hands. Using hands, you or your client can easily estimate the proper portion sizes for different types of foods. To learn exactly how to do this, make sure you scroll to the bottom of the page and click to download the bonus resources on portion sizes below. Alrighty, let's summarize what we've covered on day 2. While there are general guidelines for how much to eat and how much weight to gain in pregnancy, it's more important to focus on healthy, self-caring choices that try to follow physiological hunger and fullness cues. By focusing on balanced, nutrient-rich foods and flexible eating habits, you or your client can support your health and the baby's development throughout pregnancy. To do this, I encourage you to work on 2 general strategies. First, eating the right amount of energy for each stage of pregnancy, and second, learning and honoring the body's physiological cues. You can practice these strategies with 5 different tactics. Number 1, check for hunger. Number 2, use a hunger and fullness scale. Number 3, eat slowly and mindfully. Number 4, eat smaller, more frequent meals. And number 5, have known portion sizes for various meals. Remember, none of these are hard and fast rules. Don't worry about getting this or anything else perfect. Just do your best and eat a variety of foods you enjoy, including occasional, less nutrient-dense foods. If you're a coach, you can help your client experiment with these strategies bit by bit while encouraging her to be kind to herself and not worry about getting things exactly right. Of course, all of this becomes more complicated when you throw in additional challenges like cravings, food aversions, nausea, and digestive issues like heartburn and reflux. How can you look after your nutritional needs while dealing with some or all of these other issues? And as a coach, how do you help your client ride these waves? That's what we'll explore tomorrow in day 3 of this free course. But before you go, I want you to know, today we just scratched the surface on nutrition and weight gain during pregnancy. If you want to dive deeper into this topic while learning everything else you need to know about how to keep women safe, healthy, and strong during pregnancy and postpartum, check out our pre- and postnatal coaching certification. Just scroll down on this page and click the pink button that says Join the free pre-sale list to learn more. See you tomorrow.